In this lesson, we'll be talking about occupational therapy. The goal of occupational therapy, or OT, is to help people to improve on their everyday life skills. If they improve on their everyday life skills, then they can become more independent, and then they are able to do more in life. For people with autism, occupational therapy programs can range from play skills to learning strategies, and also often includes help with self-care. For our son, the occupational therapy strategies they used also helped him to manage his sensory issues. When our son was first diagnosed with autism, the pediatric psychologist that tested him at the Autism Center included these words in the report, and I will read this to you. She said, "Grayson has had some gross motor weaknesses and general coordination and motor planning deficits since he was a younger child. This is not uncommon in the population of children with autism spectrum disorders. He may benefit from having an occupational therapy evaluation to determine if he would benefit from these therapeutic services." Then she also went on to say this, and again I'm reading this to you, "Grayson is showing some deficits in the area of daily living skills and interpersonal relationships. Here are the skills that Grayson is specifically weak for at his age. Adaptive skills to address are washing and drying his face, showering and drying himself with a towel, wiping after a bowel movement, helping prepare simple foods, using the microwave, putting clean clothes away in the proper place, demonstrating concern for others like giving hugs and encouragement, noticing and offering help where needed, and attending to the likes and dislikes of others." Now, again, she went on to say, I'm almost done, that parents and his therapist can begin to teach Grayson these skills by breaking them down into steps and rewarding successful completion. So, these are the things we worked on at home and the things that our son worked on with his occupational therapist. I would say that these skills did not develop in him overnight. Some of the skills came easier than others. Some of the skills that were included on the list of things that we needed to address it took him years to acquire that skill and to get better at it. However, I can now say with confidence that as an 18-year-old, our son can successfully wash and dry his own face, shower and dry himself with a towel, wipe after a bowel movement, help prepare simple foods, use the microwave, put clean clothes away in the proper place. He actually now does all of his own laundry. He can demonstrate concern for others, give hugs and encouragement. He can notice and offer help where needed, and he also attends to the likes and the dislikes of others. Our son greatly improved a lot of these skills because of the occupational therapy that he received. Our son's occupational therapist was at a medical clinic about 15 minutes from our home. They accepted our insurance and were at a low-cost deductible for our family. Our son met with the therapist after school 2 days each week for an hour. Over time, his sessions went down to a half an hour each. Then he went down to meeting with her only 1 time a week. And finally, he stopped meeting with her altogether. During his time with the occupational therapist, she also worked on helping him with his sensory issues. She would give him a plastic container of rice or sand, things he did not like to touch. And inside the container would be a small plastic toys, a whole bunch of them. Our son would have to find all of the small plastic toys from the container and pull them out one by one. At first, he could use tweezers or tongs to pull each object out, but eventually she made him use his fingers and she put up his entire hand in the container. All of these skills she had him do gradually over time. However, this simple therapy strategy helped our son to overcome having to touch gritty things or sticky things that he would otherwise always avoid touching. Now, you might think, is this really a big deal? Yes, it's a really big deal. Because before our son's therapist worked on this skill with him, he would not touch the tube of toothpaste he used each day to brush his teeth because it might have something sticky on it. These are skills that are life skills that are a really big deal. Now, one might think, can't everyone learn how to self-care or do simple things that need done each day? And the answer to that question would be no. Some people can't, at least not without a lot of patience and help. Our 2 younger boys were able to self-care and do simple daily tasks independently, with little instruction, much younger than our oldest son with autism. In fact, if our son with autism had not received occupational therapy at home and with his therapist, there are skills he still may not be able to perform on his own. Occupational therapy teaches life skills, and those that are certified therapists can help you to navigate what life skills are appropriate for the age and stage of your child, your unique child with autism. When our son was younger, riding a bike was not something we ever thought he would have the coordination to accomplish. However, when he was 12 years old, it finally clicked with him. Holding a pencil correctly without it bothering his sensory feelings in his fingers was a huge problem when he was in elementary school. Our occupational therapist provided some special pencil grippers that were designed just for kids like him. It was great. He was finally holding a pencil without tiring him out because he finally could adjust to the feel of the pencil in his hand. All of these things were accomplished through occupational therapy. And now that our son is a high school senior, I arrange for our groceries to be picked up when our son gets home from his school day. Guess who puts all of the groceries away each week? It's our son. He knows where the refrigerator items go, where the freezer items go, where the pantry items go. These are life skills that he needs if he ever wants to be independent. And they don't come naturally to him, so these skills need to be taught and they need to be practiced. Some questions for you as we end this lesson. Number 1, what life skills is your child currently lacking? Number 2, in what ways might occupational therapy benefit your child? Number 3, are you able to teach the life skills your child needs on your own, or do you need help? Only you can answer these questions. So take some time to think about these things and remember, we are on your team.